Nobody could believe it. When Dr. No placed the scalpel over the abdomen, everyone thought it was going to be a simple operation. But within just a few minutes, what came out from inside would take the entire team's breath away. Close to midnight, an emergency code was issued at the clinic in Boston. When the phone rang, Dr. No was already exhausted. He had seen four different patients that day and had been on his feet for hours. But this call was different. The patient has severe abdominal pain. His condition is worsening, the nurse said in panic. Dr. No took a deep breath and, with years of experience, keep his composure. At that moment, the only thing on his mind was saving the life lying on the table. As he walked down the corridor, he saw the fear in the eyes of his team. Everyone expected a simple gallbladder procedure, but Dr. No's instinct told him something else. No one knew yet that this surgery wouldn't be an ordinary case, and in just a few minutes something could happen that would change everyone's life in the room. The operation room was ready. Sterile covers laid out, machines humming, rhythms echoing from the monitors. Dr. No raised his hands. "We are starting," he said. There was determination in his voice, but a different kind of tension flickered in his eyes. When he made the first incision, everything seemed fine. The start of a routine operation, the team exhaled in relief. But just a few minutes later, Dr. No's brow furrowed. "Wait, there is something strange here," he said. The nurses glanced at each other. In that instant, the silence in the room was broken only by the rhythm of the patient's heartbeat. There was a hardness where none should be, not in the gallbladder or stomach region. Dr. No guided the scalpel a little deeper, and then his eyes caught on something. "You haven't seen the biggest surprise yet." He raised his hand. "Everyone stay calm," he said, but the tremor in his voice didn't escape the team. What he was looking at was something so rare, even in his decades-long career. One assistant whispered, "Doctor, what could this be?" Without taking his eyes off it, Dr. No replied, "I don't know yet, but we must be careful." As the minutes ticked by, tension in the room grew. The patient's pulse quickened on the monitor. Oxygen levels began to drop. It wasn't just about saving a life anymore. It was about safely uncovering this unknown presence. And at that moment, Dr. No had to decide. Either stop the procedure or step into the unknown. From the corridor, a nurse's voice called out, "Doctor, the family is at the door. They are panicking." But inside a far greater panic was about to erupt. When Dr. No cut a little deeper, everyone in the room stepped back. Beneath the bright surgical lights, a hidden mass began to emerge. The team held their breath. One nurse whispered, "Doctor, this isn't normal. You won't believe it, but the real shock was about to happen." Dr. No inhaled deeply, and as his gloved fingers touched it, a shiver ran through his body. Inside the abdomen was something impossible. A massive foreign object left there years ago due to a misdiagnosis. When its metallic glint caught the light, one of the team blinked. "How could this have stayed inside the patient for so long?" they asked. Without raising his voice, Dr. No replied, "We can't think about that now. First, we save his life." Suddenly, the heart monitor shook. Beep, beep, beep. Faster and faster. Oxygen levels were falling, the patient visibly gasping. Sweat dripped from Dr. No's forehead. This was no longer just a medical bed. It was a race against time. "Quick, prepare the blood transfusion. Increase the oxygen," he ordered. Everyone moved in a panic, but Dr. No's voice remained steady. He was just about to pull out the foreign object. But then, something unexpected happened. "Wait a second. What you have seen so far is nothing." Just as he removed the object, he noticed something else shifting inside the abdomen. His eyes widened. "No, this is impossible," he whispered. The nurses exchanged glances, frozen in place. In the suffocating silence of the or only the piercing beeps of the monitor could be heard. And right then, the object in Dr. No's forceps caught the light. The door burst open and security guards rushed in. The family shouted, "What's happened? What's happening? What's wrong with the patient?" Dr. No turned, his voice calm but his eyes dark. "What you see here almost took his life, but the worst part," before he could finish, the monitor flatlined. Everyone froze. Dr. No's hands hung in midair. A dreadful silence filled the room, and Then one question remained: was the patient still alive, or was it already too late?